Africa is home to some of the world's richest natural resources. Sitting on a treasure trove of untapped potential, Africa has over 30% of the world's mineral reserves. No wonder Africa has been seen as the future of global supply chains.
But it's not just about the minerals. Africa's fertile land makes it the perfect place to cultivate a variety of crops, everything from cocoa, coffee and tea to cassava, maize and legumes. It's a market that feeds billions and offers huge growth potential for investors looking at the future of food security and agribusiness. By the way, my name is Hawa and I represent the western part of Africa.
And that's just the start. Africa's energy sector is rapidly evolving with abundant natural resources like solar, wind, and hydropower. The continent is positioned to become a global leader in renewable energy. Countries like South Africa, Egypt, and Kenya are already making significant strides towards energy independence and sustainability.
Don't even get me started about what makes Africans stand out. Of course, it's its people, the young, dynamic, and entrepreneurial spirit that is fueling the rise of technology and innovation. We are seeing incredible growth in sectors like fintech, e-commerce, and mobile technology. The continent's digital transformation is creating new opportunities for businesses and investors, and the pace is only accelerating.
Discussing trends, challenges, and opportunities available in Africa is what we discuss on Invest Africa Podcast.
Invest Africa Podcast.
You are Africans. We are Africans. Louder. We are Africans. Louder. We are Africans. Come on, Africans. Yeah. We are Africans. I can hear you. We are Africans. Louder. We are Africans. Come on, Africans.
So whether you are a seasoned investor or someone looking to explore the emerging markets, the Invest Africa podcast is here to help you navigate this exciting landscape. Join us as we take you on a journey through Africa's abundant resources, thriving industries, and the game-changing investments that are shaping the future of the continent.
The Invest Africa podcast, shaping Africa's investment landscape.
Hello, everyone. Welcome to the Invest Africa Group podcast. I am your host, Mubarak Abimbola, and with me is my wonderful and delectable Awa Adegbite. Today, we are diving deep into one of the continent's most pressing challenges, the state of healthcare infrastructure in Africa and how it stacks up globally. We will explore what are the best performing healthcare systems globally, which African countries are doing relatively better. I think South Africa or probably Morocco or maybe Tunisia, and what we can learn from them. We'll pivot to key drivers of the lag, is funding gaps, brain drain of doctors and nurses, insurance coverage and private sector innovation. I'm talking about telemedicine, startups. Then we'll also highlight the role of diaspora medical professionals and how they're bridging gaps. Along the way, we will share case studies and real-life stories. Later on, we'll bring in a trending investment news section and wrap up with opportunities and pitfalls for investors in Africa's health sector. So strap in, because we are going to cover a lot of grounds, but we promise to make it engaging, insightful, and yes, fun.
Well, thank you, Mubarak, for, exposing everything we'll be talking about today. You've done a wonderful job. Hi, everyone. My name is Hawa, and I am thrilled to be here as always. So if you've listened to our previous episodes, or if you haven't, we've laid down foundation for today's topic, right? We've talked about several episodes that is actually linked to today's topic. So if you haven't listened yet, I strongly recommend going back and hearing it so that, you can just have a bit of insight into what we're talking today. When we think healthcare, we often think of hospitals, doctors, maybe health insurance. But today, we'll be going beneath the hood, right? We'll ask questions like, why is it that many African countries, despite tremendous progress in certain metrics, such as life expectancy or vaccine coverage, still lag behind global best practices when it comes to infrastructure, human resources, financing, and innovation, right? We'll also be comparing with top tier systems such as Singapore, the United Kingdom, UAE, and other developed countries now. And what does this actually mean for investors, policymakers, and for citizens? So, guys, we'll also be including stories, like Mubarak said. Although the stories might be complex and emotional, but they are full of opportunities. And we hope that by the end of this episode, we'll have been able to walk you through the healthcare systems in Africa and walk away with rich understanding of what it's like. So let's get into it.
All right, let's dive in with comparative overview. Okay, on the global stage, you have countries like Singapore, the United Kingdom, the United Arab Emirates. That regularly feature among the best performing health systems. For example, ranking sources showed that Singapore is in the top tier for healthcare quality, infrastructure, and also the deliveries they get. What makes those systems strong, you may want to ask? A few features that stand out: high quality infrastructure, probably hospitals, diagnostics, and even technology, well-trained staff, good regulation, universal or near universal coverage, strong governance and accountability. This is what I've observed. They invest significantly in their healthcare. Now, let's look at Africa. Among the strong performers on the continent, you might list South Africa, Morocco, and Tunisia. These countries have relatively advanced private healthcare sectors, and they attract some medical tourists and offer relatively good services in the regional context. For instance, Africa is increasingly turning into a medical tourism destination, with countries like South Africa and Tunisia cited. But even these stand out against a more challenging continental backdrop. Many African countries still allocate far less than the recommended 15% of national budget to health care. The target set in the Abuja Declaration. The bulk of African countries remain under 10%. So what's the gap? Yeah, I know that's the next question. The gap is huge. There's the gap in infrastructure, there's the gap in the workforce, financing, insurance coverage, access to rural or urban divides. That gap is what we are here to explore on this conversation today.
Right. And to flip that question, I think we should be asking, what can African systems learn from the global leaders? One major lesson: the importance of investment in infrastructure and technology. For instance, the strategy for quality health infrastructure in Africa 2022 to 2030 by the African Development Bank notes that current capital expenditure by African governments is approximately $4.5 billion per year, far below what is required. Another lesson that we need to look out for, that African leaders need to look out for, is human resources. The global systems have strong staff-to-patient ratios, good training systems, retention mechanisms, and just to state a few. In Africa, for example, in some countries, doctor-to-patient ratios are still as low as 2 doctors per 10,000 people. Right? That is, a huge divide. Also, governance and accountability matter. Yeah, the Afrobarometer survey found that 58% of Africans across 39 countries in 2024 say their government is not doing well at improving basic health services. So this comparative overview shows that there's a huge gap, right, and much of it is structural challenges.
You are so right. Looking at the doctor to patient ratio, I mean, we have countries that have as low as 2 to 10,000 doctors, and it's quite saddening because you would realize that if African leaders can invest the amount they use in medical tourism, in flying to the UK, in flying to France, in flying to the Saudi Arabia just to get health services, if they invest all those amounts into their country's healthcare system, the story will be quite different. Well, let's dig into three interlinked structural issues, okay? Earlier, I mentioned the funding gap, I mentioned the brain drain, and I also mentioned the insurance cap. Now, let's link these issues together and let's see how it works, okay? Many African countries have low budgetary allocation to health. It's so clear and it is visible to all. According to Africa's CDC's April 2025 release, official development assessment to health fell by about 70% from 2021 to 2025. Meanwhile, countries expect to service external debt of about $81 billion by 2025, which further squeezes fiscal space. The African Development Bank strategy for quality health infrastructure also emphasizes that the current $4.5 billion year of capital investment is insufficient given the scale of need. The reality is, most African countries have debt they are servicing, which is very enormous. Then the amount they invest for health is relatively low. Hence the reason why the funding gap is so visible. Another structural issue is the brain drain of doctors and nurses. According to a June 2023 article, healthcare professionals from Africa are migrating to Europe and North America in large numbers due to poor working conditions, low pay, lack of equipment. More specifically, analysis shows sub-Saharan Africa has about 24% of the world's disease burden, but only 3% of the global health worker workforce resides in sub-Saharan Africa. These losses undermine health system capacity and perpetuate underservice, especially in rural or public sectors. Insurance coverage. In many African countries, reliance is high on out-of-pocket spending, which creates financial risk for households. For example, in Nigeria, many families face the choice of either paying abroad or accepting substandard health care locally. Without robust national health insurance, people remain vulnerable, and this gap also limits preventive care, early detection, and equitable access. In fact, I can say for a fact here in Nigeria that the only set of people that benefit from health insurance are those that work in the official sector. That is the 9-to-5ers, those that get to benefit from the company's HMOs. Otherwise, many people pay out of pocket to get healthcare services.
Absolutely, Mbak. That's a very valid point, right? How do you expect the market woman on the street to have a health insurance, right? Those are the things that we need to look into, in African countries. Let me give you a concrete story. In Nigeria in 2022, estimates indicate Nigeria spent over $1 billion on medical tourism abroad because local facilities could not provide required care. That's a huge capital flight, and it reflects how the financing and workforce gaps have real human and economic costs. Now, why do these three issues link, right? Because underinvestment leads to poor infrastructure and equipment. Poor infrastructure plus low pay leads to workforce leaving. Workforce loss plus limited insurance or financial coverage leads to medical tourism or untreated illness. It's obviously a vicious cycle, right? And to add more depth to what Mbarak has said on the funding side, the strategy for quality health infrastructure emphasizes not only capital investment, but also maintenance, operations, and upgrades. Many African hospitals are outdated, have intermittent power or water, outdated diagnostics, right? that adds to cost and reduces qualities. All of this leads to underservice, low trust in public health systems, and ultimately patients either pay more out of pocket, skip care, or travel abroad.
Now let's shift to a more positive and forward-looking part. Okay, I mean it's not all gloomy. Let's look at what is working, especially in private and innovation space, and how investors might tap into this. Across Africa, a wave of health tech startups, private insurance innovations, telemedicine platforms, and mobile health, that is ML solutions, are emerging. For example, an article published January 2025 says health tech startups across Africa raised over 500 million US dollars in 2024. Another source noted that in the first half of 2022, EdTech startup raised about $3.5 billion. That is 131% increase over previous periods. Now, what are some of the innovations that we've seen in the healthcare system of Africa? One of them is telemedicine platforms that enables remote consultation, diagnostics, especially in rural or underserved areas. We've also seen digital insurance platforms, that is micro insurance that pay as you go model, making coverage more accessible. Then there is local manufacturing of vaccines and biotech. Example of that can be the one I read about Morocco, that is in 2024, when Morocco, through a partnership of Sensu Pharmatech, developed vaccine production between Casablanca and Rabat region between about 400 to 500 million euros investment. Then we've seen supply chain and medication traceability using blockchain or mobile tech to reduce counterfeit drug. I mean, this is even more important because blockchain has made it more accessible to trace the production source, the middleman source, eventually to the end user source. This validates the kind of product that is accessible on the market to use. And this is very important. Most importantly, now that African market is filled with more fake products. Let me give you a case study. A startup in Kenya or Nigeria, for instance, offering teleconsultation and linking rural clinics with urban specialists. This kind of model shows how private sector can complement public health systems and plug the gaps. But, private innovation alone would not solve the systemic problems of workforce shortage, funding, regulation. But it can, however, be a powerful enabler. I mean, what's the best a private sector can pay? Private sector bank on the regulations provided by the government. So, I mean, we are not putting all the bulk responsibility on the private sector, but I believe private sector can be an enabler. They can be the driving force for the change we expect to happen in the healthcare system.
Indeed, Mubarak. I know the healthcare sector is especially ripe for investment because the need is huge, right? Innovations can scale faster than infrastructure-heavy models. You don't necessarily need to build a hospital. You could build a platform that serves the needs of, thousands of people on the continent. Some governments in Africa are already opening up public-private partnership frameworks in health infrastructure. For example, the African Development Bank Strategy for Health Infrastructure emphasizes public-private partnership, the PPPs, right? But there are caveats. Regulatory risk, right? Healthcare is heavily regulated. Reimbursement or insurance risk. You also need to know that if patients must pay out of pocket, then scale is limited. There's also the risk of connectivity or infrastructure, right? We are still battling with internet issues on the continent, power supply issues, all of these things are still weak, especially in many rural zones, right? And there's also the retention of trained staff. That's just something that, anyone that is well trained in Africa would find a way to go out there to the developed countries where they are more appreciated and paid well, right? In Nigeria, a private health tech platform might offer remote diagnostics, but if the local clinic doesn't have functioning lab or electricity, the value is limited, right? So the ecosystem matters. Imagine a mobile health bus traveling to remote villages, linked via satellite to specialists in Johannesburg or Cairo, conducting ultrasound and x-rays, uploading to cloud and getting input in real time. That's the kind of future that we see emerging in the healthcare sector.
Well, that's a very huge imagination, if you ask me. But let's turn to the diaspora factor, because if you look at our progression in recent times, we've been concerned about migration, diasporans, and our people abroad. Many African doctors and nurses work abroad, and most especially in North America, Europe, and Middle East. But increasingly, they are playing a dual role, serving abroad and remitting funds, investing back home, launching private facilities, or returning temporarily to mentor. I mean, this phenomenon can be a positive bridge rather than purely a brain drain. For example, the article on Health Worker Migration 2024 states that although many African medical professionals migrate, their return on investment can modernize health systems at home. A Nigerian doctor working in the UK, invest in private hospital or clinic in Lagos would definitely bring along advanced equipment, specialist training, and thereby reducing the need for patients to travel abroad. That kind of model, helps reduce the outflow of patients in terms of human and also in terms of funds, and strengthen our local capacity. Another angle where you can look at it from the diaspora medical professionals in bridging the gap that exists in the healthcare services is the telemedicine programs. Where diaspora specialists host webinars for surgeons in Africa, they help uplift local capacity. The diaspora can also provide not only capital, but human capital, networks, and mentorship. But, all these things are not automatic. Returnees often face poor infrastructures, bureaucratic hurdles, regulatory uncertainty, and funding risk. So for the diaspora to play their role fully, I believe the local system needs to be enabling, by providing clear regulations, provides investment climate that is attractive, pathways for collaborations and incentives for our diasporans to return to come invest.
Absolutely. And from an investment lens, the diaspora factor is interesting, right? Because it often brings both expertise and intent. For example, diaspora-led medical facilities may attract international accreditation, which improves trust and could attract medical tourism or cross-border patients. If you know that your doctor is trained abroad, there's just this sense of relief that comes to you. And I'm speaking for a lot of people across Africa now, right? And that's like knock-on effect for reputation and domestic health systems. However, there are pitfalls. If the private facility is only accessible to the rich, it may widen inequality. If the public system remains weak, you may end up with a two-tier system. So policymakers must ensure that diaspora investment don't just benefit the elite, but also build capacity in the broader system, right? We're talking about referral linkages, training, and public-private collaboration. In Ghana, for example, there has been efforts to attract Ghanaian overseas doctors to work short stints in Ghanaian hospitals, transfer skills, and mentor local staff. I mean, that's a brilliant idea. So they're not saying, relocate down to Ghana forever to start working. Just come, mentor some people, do some work, show some, international talent here, train some staff, and go back. that kind of initiative, right, is promising. So in our big picture, we are talking diaspora involvement plus private innovation plus improved financing and workforce retention, right? And that we believe is the pathway to narrowing the gap in the healthcare system now.
Now, let's bring this alive with some case studies from Africa. I mean, I'll be looking at contrasting ones, most importantly, looking at regions in Africa. Let's divide the continent into three. Let's look at the Southern Africa, the Northern Africa, and the Western Africa. And let's see how the healthcare system is in these three regions. Okay, let's start with South Africa. South Africa is among the more advanced healthcare system in Africa, particularly in the private sector. I mean, the country has served as a regional hub for medical tourism. For instance, I think I mentioned it at the beginning of this particular show that North Africa and South Africa are leading in medical tourism in terms of numbers of foreign patients. So a patient from another country travels to Johannesburg for heart surgery because the cost is lower there than in Europe and quality is acceptable. I mean, that indicates that when infrastructure, workforce, and cost align, Africa can compete globally. But at the same time, public hospitals in South Africa still face strikes, staff shortages, long waiting times. So the two-tier system still remains a challenge. In fact, I can give a real insight to this. I don't know, I was scrolling through TikTok one time, I think probably a few weeks ago, and a lady, just like everybody up on this get ready with me trend, a lady did a get ready with me trend on how she got a BBL. I mean, I was surprised that, okay, someone could be so vocal about how they got a BBL. But what's more interesting is the fact that this lady came all the way from the United Kingdom to South Africa to get a BBL. Why? She said she believes it is cheaper in South Africa, and the services she got was better compared to our friends or our peers that did theirs in Europe. Now, what am I saying? Yes, when the cost is very relatively affordable and the services is good, trust me, Africa can compete. Now, let's now go to North Africa. I mean, I mentioned earlier that the vaccine manufacturing investment that is, rooted in Morocco has really showed ambition to localize high-value manufacturing. Imagine if we can invest in production of healthcare materials. It will really lessen the price of healthcare services in Africa. Probably when I'm talking about West Africa, I would mention the cost of drug procurement. Then we can now compare why there is gaps in the healthcare system of Africa. But North Africa is also cited as one of the place of medical tourism, most especially Tunisia in particular, for plastic surgery, dental care attraction with lower cost. And probably because of their francophone nature, it gives them linkage to coastal tourism synergy as well. But again, even the countries in the North Africa still have workforce migration issues. They still have financial issues, and then the rural access as well as insurance coverage. Now to West Africa, which I can tell you all the challenges top of my head without even looking at anything, because I've explored West Africa. That includes Nigeria and Ghana, to be precise. I mean, the challenges here, some people say it is acute, but I tell you that the challenges in West Africa in the healthcare system are very chronic, in the sense that the migration, the brain drain that is happening in Africa really comes from the West Africa more than other part of Africa. The medical brain drain that Africa is experiencing comes from the West Africa more than the South Africa or the North Africa. If you take a sample of medical professionals in Europe, in North America, African medical professionals in Europe and North America and Middle East, you would realize that there are more West Africans in the medical sector of Europe, North America, and Middle East than any other region in Africa. So Nigeria reportedly loses about $1 billion annually to medical tourism. In Ghana, the case is the same. Brain drain is also everywhere. There's also financing gaps. Brain drain, even in Ghana, is even failing medical tourism of about $10 billion annually. I mean, this is according to a particular report. And, the individuals with means to travel abroad leave those without means. And the disparity, the gap is widening. People start hating on those that can afford it. And this is going to really come back to the government. These challenges of having a huge gap between the privileged and the underprivileged. Once the gap is widening, it becomes a problem. So all these stories I've mentioned, whether from North Africa, South Africa, and West Africa, are illustrating that when infrastructure, workforce, finances aligns, African can show strong performance. So when this gap persists, the system strains, patients are either underserved or they look out for alternatives.
I've actually just been listening to Mubarak, and I am getting one or two things from all you said. Thank you for explaining so elaborately, right? The contrast within African countries here. And it's safe to say that I've been able to pull out some key takeaways from these case studies. Firstly, access and quality are highly correlated with financing, with infrastructure and human capital, right? Also, medical tourism is not purely a loss, because if people from UK would come down to South Africa or Tunisia to get quicker and, should I say, more affordable healthcare services, then it's not a loss if we look at it, especially for the African countries, right? So if it's managed well, it can drive investments back into local system, right? But more often, it's a drain of capital. Also, innovation and private sector fill gaps that don't replace core public infrastructure, right? The gaps they fill also don't replace workforce retention or policy regulation. And diaspora and private investments can catalyze change, but they need supportive policy ecosystems like clear regulation, incentives, public-private partnerships rather, frameworks and accreditations, right? The healthcare system is a sector that needs to be tapped into, and it requires, a lot of innovation. It requires a lot of work that can actually be done. And as we move forward, right, towards the next sessions, we need to keep in mind that for investors, policymakers, NGO actors, the interplay between these structural factors is critical if you want to think of any solution in the healthcare sector. Okay, now, as we promised, let's pause for a trending investment news break, right? Like always, we'll always bring you current real-world developments that tie directly into our topics, basically.
You are Africans. We are Africans. Louder. We are Africans. Louder. We are Africans. Come on, Africans. Yeah. We are Africans. I can hear you. We are Africans. Louder. We are Africans. Come on, Africans.
So according to an article from June 2025, the African Export-Import Bank reports that Nigeria alone loses about 1.1 billion annually to medical tourism, and they have launched a dedicated health and medical tourism program to reverse the trend and fund a 170-bed Africa Medical Center of Excellence in Abuja. Wow, that's a good one. Also, in January 2025, an article noted that health tech startups across Africa raised over $500 million in 2024. And this just shows that there's growing investor confidence in digital health solutions.
Well, you said wow after talking about a 170-bed African Medical Center of Excellence in Abuja. And I don't know if I was to knock you or just give you a side eye. Reason is because I mean, even though I was not born then, I remember that the University College Hospital, UCH, the first tertiary hospital in sub-Saharan Africa, used to play host to the Saudi royal family in terms of healthcare services. Unfortunately, reverse is the case. What means is that back then, the Saudi royal family would come down to Nigeria. They would come down to Ibadan, to UCH, to get healthcare services. Do you know what that means? But reverse is the case now. It is now our own politicians that are going to Saudi Arabia. In fact, it was alleged that one of Africa's country's president died in Saudi Arabia. I mean, I don't want to mention him, but it's so saddening, yeah? So that was why I looked at you when you said 170 bet. Like, do you know, is that bad? Afrexim now needs to start donating funds to God help Africa. Well, moving on, the 2022-2030 strategy for quality health infrastructure in Africa by AFDB has also underscores that current health infrastructure investment is only $4.5 billion per year, which is below required scale. Now, what this signals is that there's capital chasing the healthcare space, okay? There's clear awareness of the lost value and there's strategic direction towards infrastructure improvement. So for investors and policymakers alike, these are important breadcrumbs. But before then, let me add to the fact that with global medical tourism market projected to grow from $115.6 billion in 2022 to $346 billion by 2032, which is approximately about 11.6 to 12% increase globally, Africa needs to capture a fraction of that growth by building competitive medical healthcare hubs that could translate into, significant revenue, jobs, and health system strengthening. However, investors should be alert about the risk that, that comes along with all these numbers. Okay, regulatory uncertainty, currency exposure, infrastructure delays, workforce retention issues. I mean, we'll talk more about all these in the next segment when we talk about opportunities and pitfalls. For now, let's continue to dive deep on, why Africa's health infrastructure lacks.
That's actually a question that I was thinking about when you're talking about the University College Hospital, right? Because if it was that good years back, now that there is innovation, now that there is more money, there's more capital, more students, more talent, what exactly is happening, that the infrastructure keeps dwindling down, yeah? So I think we should look at it from this way. I mean, from what we've been saying, both from reports, both from case studies, we continue to see our government showing a lack of interest in healthcare sectors through underinvestment and inefficient spending that they've been allocating to healthcare. I really don't know which I should say is, well, education is way low. So the funding gap is large, right? And inefficiencies persist, right? Only, for example, now, only 26% of health systems were technically efficient according to a recent study, yeah? And the fact that we keep losing our workforce can actually be linked to this, right? Because even where there are limited equipment that exists, human capital is weak, right? So you see a lot of our talent migrating and the internal brain drain just reduces capacity. Hospitals are outdated, equipment are lacking, utilities are unreliable, patients have to pay extra costs to fuel generators for surgeries to take care of them and things like that. And rural communities that still form the largest of our population still have very limited access to these services. Yeah, we have to pay out of pocket with huge sums of money, right, if you want to get the best care. I remember Mbarak mentioned earlier the huge amount of purchasing drugs in Nigeria. Mbarak, I noticed something. I was at a pharmacy few weeks ago. I wanted to get some drugs for my mom, and something really shocking happened to me. The attendant brought out the same kind of drug, right, in like 3 different manufacturers or something like that. She said one is from Germany, one is from Nigeria, and one is from US or something like that. And the price difference was like the gap was too high. To just add context to this, yeah, let's say the one for Germany was like 50,000 naira, right? And the one for Nigeria was like 14,000 naira. At that point, I was scared that, yes, I even had less than the 14,000 naira, right? I could only afford the one for Nigeria. But I was scared that I was buying fake. Because what will happen with the one from January? Did that one not work better, right? Because it's way higher, and maybe because of the manufacturer or something like. So I was trying to ask this lady, what's the difference? Can you explain to me? But yeah, the service was quite low. You know, it just puts me in a kind of phase, like what's happening with the whole pharmaceutical industry. And why is that at that point you have to bring both original and fake and expensive for me? What would that do to me as a patient, thinking that I'm not buying, you know, the best thing for my health? Things like that are some of the things that weakens our healthcare systems in Africa.
Well, I can understand the dilemma that you faced when you went to purchase that drug, and it can be quite sad. But you see, I've come to a realization that in as much as there's so many adulterated products in the market, buying from the right or from a genuine source saves you that stress. And one thing I've noticed, because I have siblings, I have families outside the country, and they beg us to buy drugs for them right from here and sent to Europe. Okay, I mean, that shows that there's something that is working, or the drug designed here or produced here in this part of the world works for them, even outside the country. I mean, probably genetics, I don't know. I'm not a medical person, but I want to believe there should be a rationale and an explanation for that. And I quite agree with you that, yes, insurance, infrastructure deficit, work losses, all these perspectives brings lag matters. Yeah. I mean, let's talk about preventable diseases. I mean, now Africa still faces both infectious diseases and rising non-communicable diseases, stretching systems built for different eras. I mean, it's quite sad that we've not still been able to, grow past the era of transmission. Yeah. Preventable disease remain high because diagnostics and early care are so weak in this country. You'd realize that I think I came across a report just last week that the number of HIV/AIDS patients are increasing by the day. And you would ask yourself that in 2025, when there is information, large amount of information for you to digest, to prevent this, a lot of people are still contracting communicable diseases. And that is basically because of the fact that there's no early diagnosis and early care. So families are facing catastrophic health expenditure, pushing them into poverty. I remember I mentioned one that drugs are very expensive. There's a particular antibiotics. Most Nigerians use these antibiotics for anything. I don't know. It's called Augmentin. Okay. I remembered there was a particular time that drug was for 1,400 here in Nigeria. I think that's about 7 or 8 years ago. Then 4 years ago, it's climbed to about 2,500. In 2023, from 2,500, the drug skyrocketed to about 20,000 naira. Now, that drug is being sold for more than 20,000 naira and above. Less than 40,000, but more than 20,000 naira. Do you know what that means? So any family that is being recommended or that drug is being prescribed to, that means you have to pay 40,000 naira of your own money to get the drug. And that is impoverishing families that are already impoverished. So if policies, government institutions, insurance are available, all these things would not be there. And also, there's also lack of public trust in our public health sectors. I can bet it with you that most people would prefer to go to private healthcare facilities than to go to public healthcare facilities because they believe that they are underfunded, those that are there are underpaid, else they would not be willing to put in the work. So all these gaps are very evident, and it's not a single issue, it's systemic, it is multidimensional, and it requires coordinated action.
All right, guys. As to conclude today's episode, let's focus on what all of what we've been talking about actually means for investors. What are the key opportunities and what are the pitfalls to watch out for? Firstly, one of the opportunities to look out for is building of health infrastructure across Africa. Hospitals, diagnostic centers, labs in underserved regions, right? Because there's a low base for this already, if you can work on it, you're going to capture strong growth. Also, health tech or digital health platforms, telemedicine, mobile health, AI diagnostics, supply chain traceabilities, and all of those things, they are scalable, less infrastructure heavy, and well suited for Africa's challenges. And with investment and accreditation, African facilities could capture intra-African and even international medical tourists. So we are keeping money on the continent rather than flowing out. Another opportunity is insurance and risk pooling innovations such as micro insurances, pay-as-to-go models, mobile-based plans. All of this can actually unlock new markets in Africa because some of these things, even though they exist, they don't work, and sometimes they are non-existent, right? And diaspora partnerships like networks, credibility, important skills, something that investors can leverage. Investors can also leverage diaspora-led facilities or invest with diaspora professionals returning to Africa, right? Lastly, for the opportunities that we have, I would like to hear from our listeners other opportunities that you see in the healthcare structure or healthcare sector in Africa. We're also looking at local manufacturing of vaccines. Mbak had mentioned it earlier. If we can invest in production, according to him, diagnostic local supply chain, vaccines, drugs, things like that, they would reduce dependence on imports, create opportunities, and build resilience across Africa.
All right, since I has talked about opportunities, I hate to be the bearer of bad news, but I'll give it to you straight. Okay, I'm always looking out for your money. The pitfalls that are veiled in the healthcare sector, they are numerous, but I don't want you to look at it as pitfalls. Look at it as stumbling blocks. What do you need to do? Find a way to remove them, just to ensure that your money is safe, okay? One of the pitfalls is the regulatory and policy risk. Let's be honest, healthcare is heavily regulated. Licensing, accreditation, cross-border patient flows, data privacy, all of these matters. So investment may stall if policy framework lag, okay? Yeah, you should look out for regulatory and policy risk. You should also look out for workforce retention risk. Even a new hospital can fail, if doctors and nurses leave. Investors must assess human capital pipelines, okay? Make sure that what you bring into the table is something that can keep them into the system instead of trying to run out of the system. Then also infrastructure and utility risk, okay? This one is very important. Real estate, hospital builds are only part of the story. I mean, whenever we talk about infrastructure, everybody look at the building, they look at the equipment, but they forget to look at the utilities, the power, the water, the connectivity, the supply chain. These are things you might, that might really be of concern to you, and you have to really pay important attention to that. Also, reputation and accreditation risk. To attract patients, whether local or international, quality must be proven. So if a facility is perceived as substandard, it will struggle. So you don't want to come join the numbers that are already available. You want to stand out. So you have to bring in quality. One universal challenge to all the topics we've talked about on this podcast is currency and financing risk. African countries have currency volatility, high interest rate. As investors, you must hedge. You have to look out for the currency fluctuations, how it would affect you. In fact, you put that in your planning when you are planning. So, in short, you should think long term, systematically, not just building a premium private hospital and hope for medical tourism. It's not going to work. The greatest impact may come from integrating into the broader system, partnering with government, training local staff, linking to primary care, or leveraging digital platforms. So before you invest, do your due diligence, check local policies, accreditation pathways, human capital availability, infrastructure readiness, financing models, and ask yourself, will insurers reimburse if you allow for health insurance? Ask. Then talk about clearance for foreign investment, risk of currency devaluation, governance, and transparency. So there's opportunities and also there are pitfalls, but you know what to do. Let's close this up.
Thank you so much, Mubarak, and thank you to our listeners for sticking with us today. Today we've, really gone into what the healthcare system is like across Africa, from global benchmarks to African performance, to structural gaps, innovation, diaspora roles, and investment perspectives. I hope you feel more informed, maybe even energized to think about how you can engage with Africa's health infrastructure agenda. This isn't just about money, it's about lives, dignity, and future development. When Africa strengthens its health system, everyone benefits: individuals, families, even the economy. And as investors, innovators, policymakers, or simply concerned citizens, you can play a part.
So if you've enjoyed today's episode, please subscribe, share with friends, and leave a review. Yes, the review is very important to us, okay? While we are serving you the teas, you should also serve us the likes, the comments, and the shares, okay? Well, until next time, when we come your way on the Invest Africa Group podcast, as usual, my name remains Mubarak Abimbola, and like I would say, stay curious, stay committed, and keep thinking African first. Thanks for listening, and bye-bye.
Bye, guys.